All right, welcome to everyone to my page. My name is Dr. Alvin. Most of my patients know me as Eczema Doc. That's because my expertise is in this line of eczema. Now, I'm a primary care physician, so I'm in the general practice side. So I see patients of different disciplines. We see a lot of patients, but I give a lot of my time focusing on eczema because I am an eczema patient actually, and by God's grace, I've actually come out of it after going through a very severe phase of my life. So I know how it is to go through eczema as a patient myself. And being a doctor, it made me very curious about what is eczema and what are the basic fundamentals and what if we can relook at how we see eczema and relook at how we manage eczema. Before I start, please take note, I have to make out a few disclaimers. Number one will be a medical disclaimer, will be this speech, whatever I'm going to share with you, please take note that it is only for medical information purpose. It is not intended to replace any sort of medical consultation. For that, you will need to meet a certified healthcare practitioner at your country. You are always welcome to inbox me. I am a medical doctor, a licensed medical doctor in Malaysia, and I do actually conduct telemedicine consultation services. So if you need my help in the line of eczema, feel free to go through my videos, and you can actually look up this page and inbox me. And we have a system where we'll ask you a series of questions, and once you have answered it, then we will set up the appointment for you, and let's see what we can do to help you out. All right. So before I proceed further, am I clear? Is it clear on your side? And if you have any family or friends who are struggling with eczema, this would be a video that you will want to share with them right now because I'm going live. So this will be a great benefit. So I think the viewers are coming live now, and I'm going to keep this in English. Let me address my Malaysian patients also. Sebenarnya kalau untuk semua pesakit saya yang mendapat rawatan dari saya mengikuti protokol rawatan yang saya menggunakan untuk pesakit saya, kalau anda nak melihat video dalam bahasa Malaysia, anda boleh pergi ke YouTube channel saya, just type Eczema Doc dan anda boleh mendapat semua maklumat dalam bahasa Malaysia. Hari ini saya akan buat dalam bahasa Inggeris disebabkan supaya lebih pesakit dari luar negara juga boleh mendapat manfaat. Alright, so I'll get back to English just to translate what I've just said from patients from out of Malaysia. That for those who want to see my local Bahasa Malaysia, which is our national language. If you want to see the videos as such, you can visit my YouTube page. Just type Eczema Doc, and all my videos are in Bahasa Malaysia, which is our local language, right? So thank you so much for joining us, and let's get right down into the topic. What is eczema? Now, eczema is a chronic inflammatory skin disorder. Now, you have four huge terms there. Now, that's basically the I would say the ultimate definition. Now, there are many ways to define eczema, but everyone agrees in this. Chronic, it's a chronic problem, so it's not a one-day thingy. And some of you might have eczema which comes and goes and comes and goes, and it gets worse over time. Some of you might even have issues, and mainly the issues are manifesting in the skin. And it's the driving force of this entire eczema, unfortunately, is inflammation. And of course, disorder being out of order. Now, all this while, I've been trained in such to see eczema merely as a skin disorder, and of course, by definition, it's also an interaction between one's genetic predisposition factors with environmental factors. So, we have triggers, like some of us might not be able to touch cats or have pet dogs back at home because we might be allergic to such triggers. So this is where the environmental factors come in. Now, what I've seen, and probably what I would like to relook and how we manage eczema, is that what if eczema is not just merely a skin disorder, but something from within? Now, being a patient, I was very curious, and also a doctor. In 2017, for those who have not heard about my story, my eczema was really bad. It went to a stage where even oral steroids were not working for me. and then I was actually indicated to be started on immunosuppressants and so forth. So, I was just thinking, if we are treating it from out to in, what if we do it from in to out? All right. I would say instead of a downward direction of treatment, focusing on an upward direction. Now, remember, these all are my clinical opinions. Now, I will differ with some of my other colleagues, but I would like to relook at how eczema is. Now, please take note. I want to make few things very clear. Number one, up to now, in 2022, eczema is not curable. I'm really sorry to give you such sad news, but the good news is I truly believe, and what I've seen in my patients over these past 4 years that I've been helping out eczema patients from all around Malaysia and also few other countries, is that if we can actually manage the eczema and get the patient to be eczema free for a very long period. Now, I can't. I would say out of a lot, I've helped a lot of patients. Now, there are few patients that are still under my follow up, which is pretty much, I would say, a very resistant type of eczema, which is not easy to manage. So I don't give you empty promises that I can get you out of the eczema. But one thing all my patients have in I would say in commonality among all, the common denominator of all of them is they actually get better, all right, and they don't depend on certain drugs or medications that they need to be on long term. So is there another way of re-looking at eczema? Now, the basic fundamental that I use is looking at from a different approach called histamine intolerance. So this is the basics for eczema in terms of my management. Now, you can have eczema as a child. I have pediatric patients who are under my follow-up as young as 6, 7 months. I had one, the youngest was 4 months, and then you continue to follow up and so forth. Now, most of them, if you are 2 month old, 3 month old, and you have rashes here, it's self-limiting. It will resolve. You just have to put certain moisturizers and all that. But there are of course certain other principles that you and me have to follow. If you want to know more, feel free to inbox me so I can help you in your particular situation. And few of the things that what we looked at is that when we treat the patient's histamine intolerance, we start to see amazing changes in the skin. Now, I'm not saying complete resolution of eczema, but they start to get better. See, my main aim is that I don't want patients. Now, my main objective for my patients, so for you to understand from where I am, where I'm managing. Now, I want my patients to be able to live a normal life. Okay, when I say as normal as possible, okay, in terms that the eczema doesn't affect their schooling, doesn't affect their work, it doesn't affect their marital relationships. There are cases where because of eczema, divorces have happened. So eczema is not just a skin issue where it's itchy. There's so many things to look at. So if I want to talk about eczema, I can take the whole day. Because this is my passion. And I believe God has given me the opportunity to treat patients in this line. So what I've seen is that there's probably something that we cannot ignore, which is histamine intolerance. So let's get right down to these basics. Now, histamine is a biogenic amine which is in the body. It works as a chemical messenger. So the heart utilizes histamine for its daily functioning. The musculoskeletal system needs it. The kidney needs it. The lungs needs it. So various systems use histamine for its daily functioning. Now, we have so many enzymatic reactions in our body. All right, so it's not just about taking this medication or taking that medication, but going right down into basic physiology, really understand how eczema works. So I'm going to talk about the basic physiology of histamine. Now, I'm going to put this into simple terms because I'm not addressing doctors, I'm addressing everyone, the public. So I'll put it into simple terms so that you can understand and go forward. Now, the body builds histamine and the body utilizes histamine. Now, once the organs use up, the different systems of our body uses up histamine, we have residual histamines or balance of histamines. Now, this balance of histamines needs to be eliminated. If it doesn't get eliminated in the proper manner, then diseases will start to manifest. And as I'm going on, you might actually see the link of your problem, and you'll understand better. And I really pray and hope that this talk can be very beneficial for you. It can really help you, go to the next step. So one of the things that we realize is that most of the patients don't know about histamine, but you know unknowingly they are taking antihistamines. They're getting loratadine for the itchiness. Have you thought about why are you given Piriton, for example, or Telfast, or Bilexten, and so forth? Why are you giving these medications and all that? Well, because they all have one thing in common. They basically impede, further production of histamine, or I would say to work as an anti-factor against histamine. So one of the driving force is histamine, and if there's a histamine overload in your blood, in your plasma, and your body system, it will drive inflammation. So I'm trying to go down to as much as I can to the probable root cause. Now I can't say guaranteed. All right, we don't have robust studies on this, but we do have a number of studies which have been published. All right, and you can take a look. It's basically available for the public to actually take a look, and you can understand better. But I'm not going to quote these studies. Let me tell you from my clinical experience. So everything is very anecdotal, but I'll tell you what of the experiences that I had with my patients, and by God's grace, they're getting better. And my only aim is for them to get better. So please take note, I'm not selling product A or product B. No, I'm just trying to get you to understand what eczema is and how we can help you to get better. So coming back to where I left off, histamines are produced, it's used up, and then you have balance of histamines. Now, this balance of histamines need to be eliminated. If it does not get eliminated, it becomes toxic to the body and it can manifest as different diseases. Now, let me give you an example. Now, Malaysians love nasi lemak. Now, nasi lemak is one of our, I would say, our superfood. Everyone loves it, right? Now, in our nasi lemak, now if those patients who are not from Malaysia, nasi lemak is made out of rice. It's made out of some nuts, anchovies, and also a thing called sambal, which is very much as a chili base. And we also add in chicken and beef for those who consume it. We put it into rendang form. Rendang is some sort of gravy-like uh, recipe for beef, or even chicken for the matter. So now, let's say you do a chicken curry, for example. Now, chicken curry is something that everyone knows, from Malaysia to the States to China to India. Everyone knows what's chicken curry, so probably I'll remain there. Now, if you cook chicken curry today and you have some balance left over and you don't get it finished by tonight, what's going to happen? You're going to get chicken curry which is going to be spoiled. And if you consume that, you're going to have diarrhea because you're going to get food poisoning, right? Same thing applies for histamine. The balance of histamines which are used up, and then you have the balance of histamine that needs to be eliminated. It cannot remain in the body. If it remains in the body, that's when a lot of issues happen. Now, who is in charge? There's a specific system where God's created the body in such a way that there is a specific enzyme which which actually functions to eliminate this excessive histamine. Now, this is called diamine oxidase. In short, we call it DAO. Now, diamine oxidase is very much founded in the small bowel. Now, we have the small bowel and the large bowel. Now, a lot of people have refuted, the link between gut and also the skin. But actually, now we are seeing a lot of links. Now, I'm going to explain to you based on basic biochemistry and physiology for you to understand the link, not just someone saying it and I'm just re-quoting it. No, I'm going back to basic science. Now, the DAO enzyme is in the small bowel and the receptors are in the villi of the intestine. Now, you have to take note that because of years of wrong food intake, like processed food, loads of lactose in our body, to milk and so forth, dairy products which are pro-inflammatory, and I can go on the list, white flour, bread, and so forth. This is actually cause a certain degree of damage in our bowel lining. All right, not to extent of probably causing celiac disease, but there is a certain degree of damage to the bowel lining, which causes a certain degree of inflammation. Now, when this happens in your gut, the DAO receptors also get damaged. So when these guys don't, they're damaged and they're all overwhelmed with injury. What happens is they don't function. So when the DAO enzyme doesn't function, histamine doesn't get eliminated. So it remains in the body. It remains in the body. So what happens? Now, the body works in such a way, and God has created the body in such a way that when one system goes down, another system tries to overwork and compensate. That's how we survive, we live. If let's say you drop, you fall down, you have a cut, that's when the whole body system works for wound healing. Wound healing, we have different steps, from starting from injury to inflammation and all the way to fibrosis and so forth. So I'm sorry, I'm talking about what do you call granulation tissue being formed, all those things. So we want those things to happen, and then of course scar formation at the end. So the body works in such a way to compensate what has been taken away or lost. That's how the human body works, and it's just amazing if you go into it very deeply. So coming back here, when the DAO enzyme does not work, the histamine levels start to rise because it's not coming out. So it's stuck. Just imagine, your local council in Malaysia, they call them Majlis Pembandaran. Now they come to collect our rubbish and throw it. If they don't collect our rubbish piles up, right? Same thing. This histamine, all right, it's just piling up and piling up. And when it goes beyond the threshold level, it will try to escape through different routes. If it tries to go, and which are the routes that it's trying to go, or what are the locations that it tries to go at? Now, these are chemical messages just for you to understand, or basic chemicals for you to understand in layman's term. Now, they will go to areas of the body where there are receptors. Now, let me explain few areas. Number one is the skin. The skin is a lot of histamine receptors. So if the histamine tries to escape through the skin, it will bind with the histamine receptor and cause a further reaction. And what is the reaction of histamine on histamine receptors on the skin? That will result in dryness, itchiness, redness, inflammation. If the same histamine goes to the histamine receptors in the sinus system, it causes sinus-like symptoms. So you're talking about having a common flu, nasal blockage, nasal congestion. So you feel blocked, you have to breathe through your mouth. And that's why we give you antihistamines, right? Nasal decongestants and so forth. And the driving force is still inflammation. That's why some of you get intranasal steroids, all right, to relieve the congestion. So if the same histamine goes to the lungs also have histamine receptors, it can cause bronchoconstriction. I've actually noticed that. I've always thinking, why is it that sometimes after my meals I feel a little bit breathless and I wheeze? Then I think, I've done my, I'm quite sure I'm not allergic to this food, but I still wheeze. Why is that? Because the histamine levels are rising. Even histamine can come from food. All right, so please take note. So there is a link of food and eczema. Are you following me all this while? Now I might not be able to read your comments because I'm on StreamYard. So anyway, please keep it coming so I can really understand these things. Let me just let me see if I can. So far I can't see anything yet. It's my first time using StreamYard on my page, this current page. I'm not sure whether I can see, but I do see your likes and so forth. But anyway, let me go on further. So coming back to where I left off. So if the histamine goes to the brain, it can cause migraine-like symptoms. Now, I've had a number of patients who came in having these symptoms, and I started them on low histamine diet. Now, a migraine patient. Now, when you have migraine or cluster headaches and so forth. Now, migraine we have different types. All right, they get diagnosed as migraine, and what happens is we notice is that you keep coming to doctor, we give you medications, and you go back. And now we have new drugs which actually are pretty good, pretty impressive. It's really dropped down the symptoms. And I found out, I had a patient who came to me, is under a neurology follow-up for the migraine. And then she was they just wanted to make sure that there's nothing she needs to be worried about. And she was referred to the internal med physician. And this patient came to me in the clinic just for a cough and cold. And then as I was talking to her, and then she started telling me she had migraine. And when I went through the list of the medications, one of the medication is actually works by an antihistamine action. An antihistamine action. And this medication, she says when she takes it, she feels better. So I told, you know what? I think you're just having histamine intolerance. All right. So I got her to change her diet, and I'm waiting for her to come back for the follow-up. Similarly, I had other patients. I had one more patient who came in with other symptoms. Now, histamine, if it also goes to the stomach is also receptors for histamine. The net effect is the stomach will start to produce more acid. So with more acid comes plethora of symptoms. So you're talking about epigastric pain, a burning sensation, reflux-like symptoms, bloating. In in Malaysia we call it angin. Some of them feel like so much of wind. But actually they are actually trying to express the sensation of abdominal bloating. So when I started seeing this, I and this patient, because histamine is a sleep inhibiting enzyme in a way. So he had also insomnia. So he told me, what, doc, can you give me some medications to sleep? And I said, no, I can't, because I'm in a primary care practice. I can't give you any sleeping tablets. I'll need to refer you to a certain specialist to do so. Then I told him, after finding out that he had reflux, he had skin problems, he had sinus issues, he had migraine, insomnia. So it seemed that he was just linking up with histamine intolerance. I got him on a low histamine diet. 2 weeks time, when he comes back, I can't even recognize him. He looks so fresh, and he tells me, "Doc, I feel much better. Hey, you were right about the diet. I never knew that diet had to do with all of this." So then, as a primary care physician, now what I love about primary care is that we get to see patients of different disciplines, and we get to spend time to really sit down and talk. So don't think your primary care doctor, your general practitioner is just there to just give you cough and cold medications. No, we can actually do more. And there are a lot of primary care doctors. It's not just me. There are also other primary care doctors who really want to go deep into root cause. But coming back here, since we're talking about eczema, so we need to try to reduce the histamine load. When we try to reduce the histamine load, the eczema can start to come down. I'm not saying it's going to disappear overnight, but it can come down. So in my treatment protocol, I have different phases. And by God's grace, most of my patients who have completed my treatment protocol, they definitely get improvements. They definitely get improvements, and they don't rely on going back to a short term of heavy medications. All right, heavy medication. Now, remember the basic uh, fundamentals for treatment of eczema are steroids. Now, don't be scared of steroids. I just want you to take note, because I do use certain a different type of steroid in my treatment, but not the common ones which are used in basic skin clinic or GP clinic. It's a little bit different. So let me explain to you about the 5 types of steroids for you to understand, because many people are steroid phobic. All right. Now, the normal common steroids which are used in clinics are, example, direct steroids. So you're talking about low potent direct steroids like hydrocortisone, and then if you go up the ladder, you can go up to betamethasone, from Valerate to dipropionate, and then clobetasol, and the list goes on. That's what you call direct steroid creams. So you're directly applying those creams. Second will be oral steroids. So you're talking about your prednisolone. The prednisolone has long-term effects in that terms, all right? And third will be injection steroids. So you can either get IV hydrocortisone, IM hydrocortisone. You can, even in certain clinics, they give IM intramuscular prednisolone. Now, these 3 types of steroids are commonly used. Now, and there's nothing wrong with this, but in my treatment protocol, I don't utilize it. I have my reasons, because of rebound phenomenon. That's what I've seen in my patients. Now, I'm not stopping anyone from taking these medications, but in my treatment protocol, I don't utilize it. Now, what are the other 2 types of steroids that we have? The fourth one will be endogenous steroids. So the body also produces steroids. So don't be scared of steroids. Steroids are good. In fact, it's life-saving. So one of the steroids that in the body, we have different types, and it's produced by the adrenal gland. Now, cortisol is one example, and you can call it the stress hormone and so forth, but it also has anti-inflammatory effects. And the adrenal gland is so important to be able to produce it. Now we are starting to look at new uh, formation of different conditions. So now we are learning about things like adrenal fatigue syndrome, which I've never heard before, while I was a student. But now we're starting to see different practitioners from around the world start to talk about there might be a possibility of this thing called adrenal fatigue syndrome, which causes patients to be very tired, lethargic, unable to focus. So these are all chronic issues. So these chronic issues, in my opinion, cannot be solved by a drug. It has to be a lot of diet involved and a lifestyle change, because if you don't do that, you fail to do that, you just treat the symptoms and you don't get better. But again, that's my opinion. That's how I'm seeing my patients, and I stick to that. So coming here, the fifth type of steroids would be diluted steroids, which I use. So we can dilute in different depths and cycles. It can be as diluted as 1 to 8, 1 to 10, 1 to 15, 1 to 30, and so forth. But at the end of the day, even though when I use this diluted steroids in the cream which I compound for my patients, our aim is still that we don't want the patient to be dependent on the cream. Now, there are some of the patients who are still needing the cream, all right? They're still needing moisturizers. Now, I'm not just talking about diluted steroids, but even moisturizers. There are some patients, but eventually I want them to not depend. Like for me, my severity of eczema was so severe that I would, if you go to a local pharmacy, you get the big tub of moisturizer, which is about, I think, 250 grams, 300 grams, the big one, or 400 grams. Now, I used to finish it up within 4 days because I would just keep moisturizing myself, and it was so frustrating. You moisturize yourself and then the skin gets dry, and if you don't moisturize yourself, it gets so itchy, right? And of course, we have this saying that one of the driving force is also transepidermal water loss. Yeah, that's true to a certain extent. That's why we put we put good moisturizers, to give that thick layer, the protective layer. But is that a long-term solution? I don't think so. So what I feel is that again, these are all my clinical opinions. Now, I do understand that if you're seeing your doctor, you're under his follow-up or her follow-up, I would suggest if you're already subscribing to his treatment, go with it. All right, you don't have to follow me. But of course, I do just public talks. All right, so I always tell the patients who come to me, if they are under treatment of another colleague of mine of whichever specialty, what I tell them is it will be a conflict of interest to meet two doctors, and I don't want to ethically get patients out of any treatment protocol. So I always tell the patients, you have to make a decision. Choose one physician and follow, whether it be me or any other doctor. Never do this doctor hopping, because when you do that, I'm talking about for chronic issues, that's when it becomes really complicated and messy. All right, so if you're seeing one doctor, you're comfortable with that person, by all means go with that person. Okay, because you got to be comfortable with your physician who's treating you. All right, because he will know your problem. Is you don't have to re-explain each time you come for your follow-ups, for your TCAs. So coming back here, uh, I want all my patients not to be dependent on even moisturizers. So for me, my level of eczema is so severe that if you want to take a look at my pictures, you can go through my page, this current page you're seeing. If you're seeing it on YouTube, you can go to my page called Eczema Doc on Facebook. You can see more info. And then what has happened is I used to be so dependent on moisturizers. Now I don't use moisturizers at all. Remember, my level of eczema is really bad, right? And I train my patients to go through that. Now, there's also a theory of the NMT, no moisturizer therapy. Now, I do agree to a certain extent. It's by a Japanese doctor. I do agree to a certain extent, but you can't do it too early. If you do it too premature, it's very difficult to manage. So eventually, I always believe I understand the body in a way of negative feedback mechanism and positive feedback mechanism. I think when I was a student, I studied this in endocrinology. That's how the body works. When there's a lack of something, the brain gets a signal. There's a lack, and then the pituitary, for example, sends signals to the target organs and so forth. It starts with the hypothalamus. It sends signals to the pituitary sends signals in terms of hormone, enzymes, and so forth to the target organ to produce what the body is lacking. So as I said, the body system is just beautiful. Same thing, in my opinion, works for the skin's ability to moisturize. And that's why I try my patients not to be dependent. We want the body to go back into basic physiology to produce its own moisture. And a number of my patients have been very successful on that. Not everyone, but a number of my patients have been successful on that. It all depends on the severity again of the patient when they come to me. Now, mind you, the patients who come to me are always, I'm always the last guy for them to see. Okay, if they're exhausted, I've tried this, tried that, then they come to me, and then because I tell them that my way of treating is that I don't try. I avoid the temptation of trying to treat your symptoms. While we have to a certain extent, but I don't want to put so much of focus on that. My focus is trying to identify what's actually causing your symptoms to happen from within. And a few of the root causes. Let me give you a few theories of possible root causes. These are probable, and I've seen it. That's the basis of what I use for my treatment protocol, and my patients are doing really well. Number one would be the common ones. The common ones would be, of course, genetic predisposition. That's something that we can't do anything, but we can use nutritional immunomodulation to turn off the expression of that gene. All right, so we don't have to. It's something like you have a light, a light, a light where you can turn off, switch on, and switch off. So let's say you have a light in your room. Now, if you switch off the light doesn't function. The light is still there, the physical structure is still there, but you don't see the effects of the light, which is light. You don't see the brightness because the switch is off. Same thing. We I believe that from the observation of how I've been treating my patients, we can we can switch off to a certain extent, a certain degree, the expression of that genetic inheritance which the child would have, got it from the mother or the father, for example. So diet plays a huge role. So what I focus is on low histamine diet to a certain extent. But remember, some of them go too extreme where they eliminate everything. Now, I don't believe in a complete elimination, because if you do that, you will cause nutritional issues for the patient. The patient needs nutrition, so don't. It's not just about avoiding things. I want you to take note of that. I had one patient who just takes rice. I had to say, no, you can't do this. Your child is going to really be malnourished. The child needs protein. The child needs carbs to a certain extent. He needs fats, healthy fats. He needs minerals. He needs vitamins. So I've come up with a specific menu to help my patients on that. Right. So I'll even guide them on reintroducing foods, and do it progressively. So you don't want to go extreme on diet, but you need to know it's not about trying this formula or trying that formula. You need to know why you need to eat this and why you should not eat that. All right, and the necessity of what you need. So all these are very crucial. This is what I've normally covered during my telemed consultation service. Again, you can be any part of the world, but mainly most of the patients are in Malaysia. I treat most of the patients in Malaysia. So you can inbox me. You can be in Penang, Johor, Sabah, Sarawak. It doesn't matter. I can telemed has given me the opportunity to help you, to serve you, and to get you back in track. I had one patient in Kuching. It was Kuching, but in the interiors. All right, it's about, I think, 1.5 hours to 2 hours away from Kuching, and they got in touch with me, and that boy was such a good boy. I don't want to mention his name because we doctors have the doctor patient privacy ethic, so I can't reveal his name, but I can at least tell you a little bit about him. And he was struggling eczema so bad that he didn't even go out from his house for 2 years. And he's still he's a young boy. He's just it was about, I think he started having very bad eczema at 14. By the time they got in touch with me, he was 17. So 2 to 3 years, it's just bed bound, stuck in the house. But now he's out of the house. His eczema has probably improved about 70%. I'm not saying it's cured fully, but he's back into normal life. So that's my objective, to get you back into normal life, because I've reached that, and if it can happen to me, why not you? But again, I can't cure, so I don't want to give you any empty promises. I'm just showing you what can be done. Again, it all depends from patient to patient. So please take note on that. So coming back to the root causes, number one will be histamine load. So what I focus is what causes that. I want to go even deeper. So histamine intolerance is the issue. So we know that there are high levels of histamine. What's causing the high levels of histamine? What is causing from within? So one of it is, of course, a lack of DEO enzyme functioning. So how do we activate this enzyme? So the diet has to be very rich in vitamin B6, vitamin C, and quercetin. So a few examples which I add into my menu would be like sweet potato. If patients don't have abdominal bloating, very rich in quercetin. We get patients to consume pak choy. You have a lot of different parts of vitamin B in it, and vitamin C you get from the apple. And you're also welcome to supplement yourself. uh, dosages will differ according to age group and so forth. So I get them on this. I'm just giving you basic principles. Now I don't want to go on the specifics because again, I want to remind you, you cannot use whatever I said immediately for yourself. This is just a general medical information. It is very dangerous if you treat yourself. You need to get in touch with a practitioner, a certified medical doctor. You can get in touch with me or any other doctor. All right. Make sure he's a certified doctor. So these are the basic things. So that's one, the DAO enzyme not functioning, so it pushes the histamine levels up. Second would be histamine intake. So sometimes the foods that we eat are high in histamine, and the top three groups of food which are very high in histamine, especially in Malaysia. Number one would be uh, white flour based food. So you're talking about bread, bun, donuts, pastries, curry puffs, goreng pisang, for all that you know, and all that. Second would be dairy products, so milk, cheese, yogurt, and so forth. Third would be um, nightshade vegetables. So nightshade vegetables would be examples would be tomato, white potato, chili, bell peppers. In the local language you call it chili Bengal. Uh, the other one would be brinjal. And the list goes on. So these are just a few things that are very high in histamines. So you got to be a little bit aware on it. Now, does it mean that you can't eat it at all? No. I mean, I've taken brinjal, but what I do is there is a way to eat this high histamine foods. How you need to learn how to space it out. So I'm not saying that you can't eat it. You can, but you want to space it out. For example, can you eat KFC? Right. So if you give me an option, instead of going for the spicy option, go for the original option, because the spicy one, it's basically white flour, so that's another issue, right? So these are the few basic fundamentals that you need to know. So diet, the DAO enzyme not functioning. Another one will be bacterial infection. Most of them have chronic bacterial infection, and one of it will be the pathogenic Staphylococcus aureus. And what the issue is, this bacteria basically, now you do know that the skin barrier for most eczema patients are pretty much compromised. So it's very open. There's a lot of porosity. So it's very they're very prone for skin infections also, because pathogens from out can enter in, and go through, penetrate into the, from the skin layer, from the epidermis all the way to dermis and so forth. So we don't want that to happen, right? So similarly, we have realized that when there is a skin barrier dysfunction, the pH of the skin differs. When the pH of the skin starts to be altered, then you're talking about issue in the skin microbiome. Now we have a skin microbiome, so you're talking about good bacteria and bad bacteria, right? So it has to be in a balance, but there's an alteration of it. So when that happens, what happens? You basically attract a colony of pathogenic Staph aureus. I'm not talking about the physiological one. I'm talking about the pathogenic ones. And this Staph aureus has the ability to penetrate the already poor skin barrier, and it enters into the skin and it targets a specific cell called the mast cell. And if you go back to basic physiology, we have different types of cells. We have dendritic cells, mast cells. The list goes on. So one of the cells is mast cell, and the main constituents of mast cell is histamine. All right. So what happens is the bacteria penetrates inside, and it targets the mast cell, so it causes a degranulation. Degranulation means, just imagine you take an egg, you hit the eggshell and it breaks, and the yolk comes out. So just take the yolk and the white as histamine, so it just comes out. So when that happens, the histamine gets released, it goes to the skin surface, and it hits the skin with inflammation. So that's why steroids alone are not enough. Not enough to actually stop further flare-ups. Now, so you need also, to a certain extent, topical antibiotics. But then again, we run the risk of, if it's continuously applied, especially direct topical antibiotics, we have the risk of antibiotic resistance. So that's where we have that we have to play around with it. Look at the benefits versus the risk and so forth. So there are few ways that I do for my patients that I've learned. It's not just my treatment protocol. My treatment protocol is where I thank God, for the wisdom. Also the opportunity to meet other physicians, even dermatologists from other countries, functional medicine practitioners, get their take on it, and also pediatric dermatologist. One of my favorites, it would be Professor Dr. Peter Leo, all right, from Feinberg School of Medicine. And he has actually what do you call spoken about things I've never heard. What is commonly spoken about in eczema. So I love him because he tries to go down to root cause. So there are many things. Let me be frank, and let me reiterate. I'm going to end very shortly. Now, we cannot be conclusive about eczema. So when patients ask me, "Hey doc, what do you think about eczema?" I always end it by saying we have it's still a big room for us to learn. Now, I can't speak for other doctors, but I can speak for myself. I'm not conclusive about eczema. I believe, I'm learning new things and I'm very open to learn new things as long basic science can explain it. Now, you never go wrong if you go down to basics. Now, studies, of course, we have different studies. We have observational studies. We have prospective studies. We have also control trials. We have randomized double blinded control trials. We have meta analysis. So we have different degrees of it, and through studies we get clues. All right. And of course, there's always debates. One guy will say, I quoted from this study and that study and so forth. But in my opinion, as a clinician, uh, if I learn a particular study, I go through a particular study in a journal, if I cannot understand the basic pathophysiology or go back to basic biochemistry or physiology, I will never be able to understand fully of the study, number one. And number two, I will just be, taking that algorithm of treatment and just putting it on my patient. And that's not how I do, how I manage my patients. Because you have to have you have to practice precision medicine, so it has to be patient to patient basis. It's not one treatment protocol that works for everyone. It's not like a one size fits it all, but that's again for me. All right, so thank you so much for bearing me for 40 minutes. I hope that this has been educational for you. Again, I'd like to remind you, for your safety, do not take any of my advice and immediately practice it. You need to be under the surveillance and monitoring of experienced physician or a doctor. In my case, you can inbox me. Please take note, I'm not a dermatologist. I am a primary care doctor. All right. So the approach will be different. So if you want in this manner, you're always open to inbox me, and I'm very happy to help you. May God bless you. And I just want to remind all eczema patients, don't give up. I do understand the frustrations that you will have. I've been there, so I understand what the things that you go through. I also want to encourage parents who have children who are struggling with eczema. I know, looking at your child bleeding, scratching throughout the night, it can be really frustrating, and you need a listening ear. So I'm always here to hear you out and give you some pointers. And being a doctor who focuses on eczema, I'm also a counselor to a certain extent, because I always want to listen to what the parents tell me. And one thing I've learned as a medical student, Dr. Professor John Singh said, he taught me so much about how to become a good physician. I think he's in Australia now. By any chance, if you're seeing this, I hope you're seeing this. If you're seeing this, Prof, thank you. You taught me something. You taught me, in order to be a good doctor, you need to listen to your patient. Prof. John actually was admitted in Malacca Hospital when I was a houseman. So I asked him in the emergency department, "Hey, you know what, Prof, just tell me what you need. I just write it down and we'll get the treatment started." And he said, "No, I'm your patient." So he taught me so many things in that sense. That one encounter taught me that in order for you to really be a good patient or good doctor, is to really listen to your patient from his perspective, and listen, hear more than you talk, actually. This is what I've actually practiced, and I hope to do better. So may God bless you. I hope this has been beneficial for you. And if this has been beneficial for you, I would really encourage you to, you can share this on your Facebook or your WhatsApp, so we can actually reach out to more eczema patients. And feel free to inbox me in my page. If you're seeing this on YouTube, please go to Facebook. You can search for Eczema Doc. I'm accessible any part of the world. So you just have to type eczema. Let me spell it out for you. E for England, C for China, Z for zebra, E for England, M for Malaysia, A for America, space, D for Denmark, O for Oman, C for cat, eczema dog. So you can inbox me. We'll get you an appointment. We'll schedule an appointment, and then we'll get the ball rolling. So God bless you, and I'll see you soon with more inputs. Take care and have a good week.